So the standard of care for treating epilepsy and seizure is if a patient has a first-time seizure, it's really important to get a MRI, a high-resolution MRI, and an EEG. And then another important thing to get is the history. So what did the seizure look like? And oftentimes the patient can't really tell you what the seizure looked like, so it's really important to get collateral information from family, from friends, and from coworkers if they witness. So my presentation at AAPA today really focused on spreading the word about how to treat epilepsy, because despite advances in technology and science, so we now offer surgery or we have devices that can treat epilepsy, the number of referrals to these comprehensive epilepsy centers for these surgeries and medical devices, it hasn't increased over the years. And there are over 233 accredited epilepsy sites now, and despite that, there's still the same number of active persistent patients with epilepsy. So surgery is actually not new to the epilepsy field. They've been doing surgery for many, many, many years. I think one thing that is new is there's a new device called RNS, or responsive neurostimulator. It just came onto the market maybe several years ago, although they've been working on the product for a good 20 years. And it's this device that is implanted into the brain, and it can monitor your brain waves in real time. And as the physician adjusts the parameters of the device, it can actually pick up on seizures and deliver a electrical impulse to disrupt the seizure activity. So that's something newer that's really neat in the epilepsy field right now. Reservations that patients may have about surgery is with certain types of epilepsy surgery, so with surgical resections, we can't give a clear number of, your success rate will be this percentage. And so that a lot of times these surgeries are not curative, they're what we call palliative. So a lot of patients have to think very carefully, after the seizure, after the surgery, I could still be having seizures. And is that a risk I want to take?